Hey guys, Dr. Davin Lim, board certified laser dermatologist. Hey, today's video will be an update on acne scar revision. I personally think, this is my opinion only, I personally think that this video is going to change how we're going to manage acne scarring hopefully for eternity. I'll tell you why. It's because in the last 2 months there have been groundbreaking papers that have changed or evolutionized the paradigm of how we actually treat acne scars. This is the importance of things, right? So basically it's this. The whole idea about acne scar revision is this. Why not get acne scars in the first place? In other words, why do we want to treat acne scars when we can prevent acne scars? And this is the essence of today's topic. Now, 2 papers that came up, and these are controversial, but they have been peer reviewed. So the first one came out just 6 weeks ago. It was released in late June of this year, and it's a consensus. So it's not just one author, it's a consensus consisting of multiple dermatologists, pediatricians, wound care specialists, plastic surgeons, everyone board certified. And basically it shows that Accutane and scar revision can be conducted concurrently. So the exceptions to the rule include fully ablative laser resurfacing and medium to deep chemical peels. But otherwise, every other procedure that we have talked about, everything from, seriously, from subcision to fractional laser ablation to non-ablative lasers, microneedling, PRP, low-level intensity light devices, surgical procedures, the lot. Safe. The second paper, once again groundbreaking, just released by the ASDS and published in Derma, shows the same thing. So basically it's this, for patients on Accutane, right? So patients usually on Accutane usually have severe acne. And the ones that scar usually are the patients with severe acne. So this is why I say this is a groundbreaking paper, because of the fact that we can treat patients now who are on Accutane with lasers, with energy devices, and that can help reduce or prevent scarring. And that's why I say it's groundbreaking. And look, it's hard for me as a dermatologist to say what your dermatologist should do, but all I'm saying is that this is in the literature. Good doctors or good specialists should always keep up with the latest, read up on the literature, and then actually use evidence-based medicine, practice that, and deliver the results to the patients. Now, if there's any doubts at all with this, what I've done is that I've got these links down below. So if you have a look down below, you can click on and they're PDFs. So basically you can read through these papers, and like I said, they're peer-reviewed. Treating acne scars early, remodeling acne scars early is the essence of this talk. And I'll show you shortly how I've been doing it in the past and the results we get. So remember, early remodeling equals less scarring. Thanks, guys. Traditionally, severe cystic acne have been treated with Accutane for a period of between 6 to 12 months. So once we get the acne in remission, traditionally we had to wait for another 6 to 12 months before we can undertake scar revision. Scar revision is then done using laser, in this case fully ablative laser resurfacing. In this patient, which was performed nearly 10 years ago, I used fully ablative laser resurfacing with an erbium laser. The healing up times were significant, ranging between 7 to 14 days. We had skin pigmentation changes for at least 4 going towards 8 weeks, but at the end of the day, scars remodel and we had good outcomes compared to the baseline. So the whole idea now is to change how we manage acne and acne scarring. In 2012, I used what's known as the E-matrix or subablative to treat early scars together with isotretinoin. So here we can see a patient that's got severe acne, and this program treated acne and acne scarring together. So this patient was on Accutane before and after 5 treatments. I chose Radiofrequency or RF with the E-matrix because of the low downtime. So now with the paper in 2017, we can use other devices, but this was a control study done in 2012 on over 312 patients. And we showed that it had a very, very good effect due to the fact that we were combining isotretinoin or Accutane-Oratane combined with active acne scar treatments. So RF works by actually stimulating collagen while preserving the upper layers of the skin. So you can see what radiofrequency does. It remodels collagen which lies underneath your skin. We do not want to treat the top layers of your skin because the scars lie underneath. And so we found that using this program of using Accutane together with active scar management, we got very, very good results. In other words, we prevented scars at the same time of treating acne. The downtime was less than a day, the results were predictable, and most importantly, it was safe. You can see 4 radiofrequency treatments there, before and afters. And you can see 5 radiofrequency treatments here with cystic acne before and afters, prevention of scarring and the treatment of acne. This is a good example of treating acne together with active scar management. And you can see as time goes by, her scars get better and better. So the concurrent treatment of Accutane together with active scar management can actually reduce or even eliminate further scar revision procedures. This is another example of E-matrix on Accutane, and the results they speak for themselves. So what about fractional devices? I'll be talking about microneedling first in Accutane or with Roaccutane. In this situation, I'm using Infini or insulated radiofrequency needling device. This basically can dial in at a much deeper depth than what a laser can. So in this situation, I can dial in up to 3.5 millimeters down to the skin using an insulated needle, placing the energy accurately to the millimeter in the dermal layers of the skin. So even though the treatment looks somewhat horrific, the treatment actually heals up very quickly, especially if PRP is used, which is basically derived from your platelets. I then use a mask on top of that, and that basically infuses platelets and with growth factors. It basically heals up the epidermis within 2 to 3 days. So you can see me infusing a mask full of PRP derived from the patient's own blood, and these contain, like I said, growth factors, cytokines, and at the end of the day, the patient heals up much quicker than if they did not have PRP. Remember, these patients are on very low dose Accutane or Oratane, and even though there is a product information that says, hey, it's going to heal up a lot longer, no, with PRP and this treatment, patients heal up very, very quickly, especially using the mask. We've treated hundreds of patients over the last 2 years. There has been excellent response, and you can see very shortly what a patient looks like straight after PRP. Patients heal up within, like I said, within 2 to 4 days. The effects are great and the side effects are minimal. So what about derma rollers and entry-level microneedling on patients who are on Accutane or Oratane? Well, these are safe. These are entry-level treatments. These can be done at home. These are not done at specialist centers, but certainly they can be done safely at home. I do endorse 0.5 to 1 mil rolling in a safe manner. I'm showing you how to do it safely. I've done many videos on how to do safe microneedling at home. The same applies for microneedling such as a Derma pen and non-energy based devices. So I won't go into this because this is basic stuff and it can be done at home. So absolutely safe, guys, for this. So what about fractional lasers and the concurrent use of Accutane or Oratane? So this is my experience over the last 7 years. First of all, we know what fractional laser is. It's basically treating fractions of the skin while leaving fractions of other skin to actually help repair. So I use various different lasers, including a CO2. A CO2, in my opinion, is actually one of the better lasers to use. I use everything from a CO2 core to a Fractional to everything from a U laser. Now we've got the luminous laser as well. So many fractional devices. We can control the density of the laser. We can control the amount of power. In this situation, I'm treating mixed scarring in an ethnic skin type. And once again, we can hop and actually decrease the actual density while patients are on Accutane if they're sensitive. Sure, do I use fractional, pro-fractional, in other words, erbium lasers? Yes, I do. However, I do believe that this is somewhat outdated since the event of microneedling. But this was erbium treatment that was done probably about 10 years ago. So certainly pro-fractional or erbium treatment can reduce the rate of post-inflammatory skin changes or hyperpigmentation. What about Fractional? Am I a big fan of Fractional? The answer is no. Sure, a 1550 Fractional can actually help with mild acne scarring. I do use it for patients who request it, but I do believe that there are other more effective treatments. What about the newest in picosecond technology? So picosecond fractional focus, yes, it can work, but it can only work in certain ethnic skin types and early scarring. Well, let's see some before and after. So classic example of cystic acne, we treated him with Accutane, but at the same time treated him with fractional laser resurfacing. This is what we have. And once again, moderate to severe cystic acne treated with Accutane, virtually no scarring. So concurrent treatment with Accutane and scarring is minimized. Many more before and after pictures on my website. Here's another example of fractional CO2 laser resurfacing using just 3 treatments before and afters. So what about subcision and surgery for acne scars together with Accutane? This is something we do a lot. It's bread and butter of what we do. I do believe subcision is actually one of the better ways to treat acne scarring compared to lasers. So subcision itself involves the use of a needle or a no-core needle, and what we're doing is we're breaking scars from underneath. These are severe, tethered, anchored, rolling, as well as fibrotic scars, and what we're doing is actually breaking them down. Is it safe on Accutane? Absolutely. This is another technique I'm using called the windscreen wiper technique, and here I am just breaking the scars gently with the laser. It looks painful, but it's not, because it's done under local anesthetic. So this is safe on Accutane. You can see that this guy is basically scar-free. Subcision method using a filler. Is this safe? Absolutely. So this has demonstrated safety on patients with Accutane. To date, I've done over 1,800 cases and still counting, and the demonstrated safety record is there, whether I'm using filler, PRP, saline, even autologous blood. So you can see the before and afters with subcision filler in the temples, before and after in the same patient. This patient here cannot have laser due to a medical condition. She's got multiple tethered, anchored scars, and the treatment of choice is actually subcision, and she had been on low-dose Roaccutane. So this is the before and afters, multiple before and afters, not quite perfect, but pretty close. Before and afters together with subcision technique. Once again, subcision before and afters. This time I use a little bit of filler. Many other examples using subcision. In this case, no core subcision coupled with radiofrequency insulated microneedling. You can see the before and afters. Not quite a perfect result, but much improved compared to before. So angle lighting, yes, it's very difficult to get the exact angles. This is what I'm trying to demonstrate. Angle lighting is very important when we're actually taking photographs, because we can see the marked difference. What about chemical peels in the context of Accutane and scar revision? Well, this is a gray area, and this is my experience over the last 7 years. Do I use chemical peels? Yes, I do. I vary the concentration between 30 all the way up to 100%. We can use a toothpick delivery as demonstrated by Dr. Philip Young here, or my preferred delivery using a syringe technique. Once again, I am not injecting, but I'm using osmosis to actually deliver droplets of high strength TCA cross to actually the deep ice pick scars and narrow box scar scarring. So the skin heals up in 5 to 6 days, even on Accutane low dose. There is not a problem in my experience. Once again, a gray area in regards to the consensus, but this is the result we see after just one peel. This is high strength TCA peels before, and you will see the after very shortly. Once again, on patients on low dose Accutane, averaging between 20 to 40 milligrams twice a week, before and afters using surgery together with high strength TCA chemical peels. Once again, a marked difference. Many more photos on the website, but we can go on for another hour or so, before and afters in regard to TCA peels. And finally, a more difficult subject. This is someone of skin type color 4, ethnic patient with multiple ice pick scars, but also tethered scars. So TCA together with subcision, the before and afters tell the story. So once again, most patients will have post-inflammatory pigmentation, but this will settle down. So that's TCA peels. So how do I treat red acne scars, also known as macular erythema, or commonly called PIE, or post-inflammatory erythema? These are the easiest scars to treat. They need a vascular laser. Now, it has been proven to be safe in patients on Accutane. I use a purpuric setting. In other words, I give patients a little bit of bruising, and this bruising will settle down in about 4 days or so. But if you give a bruising setting, you get a very good outcome. Most patients need 2 to 3 treatments, 2 to 3 weeks apart. And at the end of the day, PIE, or post-inflammatory erythema, is one of the easiest type of scarrings to treat. And they just settle down within a few months. Fully ablative, full face laser resurfacing. This is where respect is needed in regards to the use of Oratane or Accutane in regards to full ablative lasers. So this consensus I do take very seriously. I actually give a washout period of 3 months, not 6 months. Remember, we are going at very deep depth, and we're covering the entire surface of the skin. And what I do, I also blend the surrounding skin, because that way demarcation lines are less likely to occur. So this is a full-on procedure. It is not for the faint-hearted, and it's good when the contours have been treated and the scars are all at the same level. Most of the specialists nowadays use hybrid lasers, in other words, combine CO2 fraction laser on top of that as well. You can see the results after just one treatment of fully ablative, and this is fully ablative CO2 laser. One treatment only, before and afters. This is before, and you can see shortly after. One treatment and one treatment only. But remember, guys, the healing time is significant, and hence patients do need to be off Accutane for at least 3 months. That is not negotiable. Guys, I hope you found that talk useful. Yes, it was pretty long-winded, and yes, it did go on for a while. But look, at the end of the day, I can go on for 2 hours in regards to acne scar revision. That's my passion. That's what I do. Most of my work is acne scar revision. I cannot stress, the papers themselves are there, but I've got to respect, or you've got to respect, your dermatologist or your specialist opinion in regards to Accutane and how they would proceed in regards to scar revision. All I can say is that the papers are there, the evidence is there. It's up to your dermatologist, and I do respect everyone. So they have their own opinion on things, even though it's peer-reviewed and even though it's evidence-based. Please respect their opinion. They may not wish to undertake scar revision procedures on Accutane. I can understand why. That's probably medico-legally. That's the reason why we actually have these papers. I think the first step is that Accutane itself has to change the product information. I'm not a prescriber of Accutane. I don't treat acne, I just treat acne scarring. So what I do is that I work in with dermatologists. So let's say if you are on Accutane by another dermatologist, I work in with that dermatologist. Or if you come to see me with acne and acne scarring, I treat the scarring, but then I refer you off to a dermatologist who manages acne. That's the best management, because that way patients don't get confused in regards to what's what. So guys, I hope you learned something, and remember, the basis of acne management and acne scar management still stays the same. It's always finding a method, and this is, we stress this throughout all the videos. It's always about finding a method to treat your acne scars. It's never about the device. It's not about Infinity. It's not about microneedling using the latest and greatest. It's not about using even the U laser or even the luminous laser, which we're getting, or fully ablative lasers. It's always about finding a method. And often the method is manual. In other words, finding the scar type. And that's why finding the scar type is really important, because you can classify your scars into boxcar scarring, ice pick scars, rolling scars, tethered scars, anchored scars, atrophic scarring, hypertrophic scarring. Once you actually find the scar type, you target the method to treat the scar. And once you do that, the success rate is extraordinary. So you can see from the before and after photographs, no, they're not photoshopped, that these are all real. And it's the actual finding the scar type, close observation, angle lighting, tangential lighting, and scar mapping, together with planning with a patient, that gives you the best results. So guys, if I could give you any hints, see a board certified specialist. We are trained in this procedure. That's part of our curriculum. We don't go to weekend courses. That's part of what we do in our training. So plastics and dermatologists alike, please, if you do have severe scarring, see someone. And once again, links below in regards to who I advise around the world. Thank you for all the people who've traveled all the way from Canada, France, Belgium, the UK, in numerous countries to see me, and all the ones from the Philippines, Indonesia. Look, I'm trying my best to actually create a, I guess, collaboration of dermatologists and plastic surgeons throughout the world, so that patients can receive good results, rather than just, hey, we'll sell you a laser package, or we'll sell you a Fractional or a microneedling or what have you. It's about actually treating the patient and giving the best scar results. So guys, thanks very much for watching this video. Please subscribe if you like. And like I said, I'll keep you up to date with anything new in regards to scar revision in the next couple of months. Lots of new exciting things, new lasers, stem cells, lots and lots of new things. So I'll keep you up to date. Catch you next week. Bye.